is because we understand the dire need that people in rural areas are now suffering, and we want to get them that money as quickly as we can.
Also, in the legislation that we signed in the regular session, there was about $300 million that went to address healthcare needs like that in rural regions in the state of Texas.
Secretary, I have a question for you. So you talked about telehealth being a solution for families in rural communities, but as you know, many areas of the country are designated behavioral health workforce shortage area. And so while you're saying telehealth is a solution, if you don't have the staffing across the state to address the needs of families, where do we go from here? How are we going to address the staffing issues to make sure that families and crisis can connect with someone even through telehealth? And is there a plan in place to sustain a 90-day crisis lifeline so that people can have a direct source of support? I'm sure that a family has something like this, but it's important to me to know that that resource follows all the way through to a person in need.
Sure. So we can both try that. So for one, you're mentioning a couple of things. One is the availability of telehealth. We realize that's possible in some ways, not possible in other ways. We've got to find ways to expand that. Staffing is another crisis point issue that we're working to address, whether it be on mental health related issues or non-mental health based issues. But it's, through the telehealth, that's one way in which we can actually expand access to staffing without then being there in person, but through the telehealth approach.
Two more questions.
Secretary Kennedy, that's Karen Hall with CBS News. Thanks for being with us today. My question is, in speaking of rural Texas, we know places like Uvalde have experienced one of the worst mass shootings in history. The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you still consider gun violence a public health crisis? And who's going to be...
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. You know, these kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. People, kids, my classmates, other people would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting. So there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer.
Last question.
Hold a second. He opened with that. He gets to go back to it.
Thank you, Governor. My question was, in light of the recent resignations of the CDC, how are you ensuring that that agency is able to do its job effectively?
I would say this, that first of all, I will confirm that we let go Susan Menares yesterday. I'm not going to talk about personnel issues, but you know, the CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, understands that the CDC has on its website today that among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website and look at it. Fluoridation, giving kids a toxin, and vaccines. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency.
That's it. That's all we got time for. That's all we got time for. No, that's all we got time for. Thank you. Thank you, guys.